So I don't like that. I like to keep things, you know, avoid side effects as much as possible. And as I say, if I don't have a choice in the matter, then I'd rather err on the side of a dose shy of the right dose than one that's going to be above for that person. Because the problem is, body chemistry has a lot to do with determining how these things work out. And some people, or I should say most people, you can make an intelligent guess depending on their size and weight as to what the dose should be when they're starting out. But a tiny percent at one extreme and then another tiny percent at the other extreme, because of their body chemistry, the one on this side, the dose you decided may be too big for them. So 3 weeks after they start testosterone, they've gained 10 pounds. Well, the 10 pounds is neither muscle nor fat. It's water retention. So when somebody calls me at 3 weeks and says, you know, I gained 10 pounds, then I immediately cut the dose in half. Because that's one of the few people who are extremely sensitive to testosterone. So the dose he needs is about half of what I think it should be. And then once you reduce it in half, then he gets rid of that extra water in a few weeks. On the other extreme, there's another small percentage, say 3–4%, who you give them the dose that you think should be reasonable, and then the person calls you 4 or 5 weeks later and says, I'm not feeling anything. So you raise the dose slightly, sometimes twice, and then he says, yeah, now I feel it, and you check the blood level, now it's finally beginning to rise. So there is no fixed, doesn't matter how much you know, you have to accept the fact that you have to have an open mind, communicate with the client, do the blood testing at 6 weeks, because it's the only way you're going to figure out the right dose for that given. Because everything is tailored for that person. There's no one shoe fits all. It's very tailored, it's individualized, and of course that's the proper way to do it. In addition to the fact that over time, you don't know that on day one, but over time, you want to determine for everybody what is the smallest dose that gives them the maximum benefit and no side effects. And that's where you want to be. Not the biggest dose. No, I want to decide what is this. And that is extremely relevant, especially in the area of growth hormone, because of its being a lot more expensive than everything else. So you certainly don't want anybody to be wasting the stuff and taking any more than what he needs. But in general, for all hormones, you want to find out what is the smallest dose that gives them the maximum benefit, positive benefit, and no side effects. That's where you want to be. But once you got that, doesn't mean it's going to stay at that point, because the body is dynamic and it changes. So you keep an open ear with that client in terms of how well he feels, and also once in a while you have to do blood tests, which usually are done about 3–4 times a year, on average. So that's how you keep everything in focus, the best that it can be. And it's not just the hormones. You have to check on how they're eating. Because food and supplements, especially omega-3 and vitamin D, are just as critical as the hormones. And of course exercise too. Now there's a few times throughout the year where people don't do what they're supposed to do, or between Thanksgiving and New Year there's going to be a lot of parties and eating all kinds of things and drinking more than you normally drink. Well, I mean, that's life, and it's not like you have to be a robot and do everything right every single day, all year round, as long as you're doing it most of the time. That's really all that you expect a person to do. And I tell people, like right now at this time of the year, say, I know, do whatever you want, forget about anything I told you, just, have a nice time. But keep taking the hormones though. If you're on hormones, keep taking the hormones. And then if things get out of line, in January, then we'll work on it, like more, to get it back in line.